is not really seen on the front as well. So 3D, this is 3D, everyone. 3D computerized, cone beam computerized tomography. Big source of discussion right now is people who have chronic Lyme and, you know, are their root canals um, keeping their Lyme alive? And there's a lot of studies that are underway that are starting to show yes. Now, am I telling everybody to run and get their root canals ripped out of their head? No, but if you have Lyme disease, get a 3D cone beam, see if there are any cavitations around the root canals. By the way, root canal procedures by itself are in my opinion, uh, really don't work long term. It's simply put, I think the future of endodontics is in stem cells and pulpal regeneration without devitalizing a tooth, basically embalming a tooth and doing taxidermy on a tooth to do a root canal. Because anything dead in the human body decomposes. We call it necrosis. Um, so let's take a look at sleep, airway health. I'm going to go for about another 10 minutes or 15 minutes, and then we'll do some questions. Um, so sleep and airway health is a big issue. A lot of risk with that. The dangers of sleep apnea. You have 75% of these cases are undiagnosed. 1 in 5 have obstructive sleep apnea. A lot of it has to do with the shape of your mouth and tongue tie, narrow arch. Your tongue sits further in the back of your throat, limiting your ability to breathe. It's linked to all of these risks: heart attack, hypertension, reflux, diabetes, stroke, congestive heart failure, motor vehicle accidents, and impotence. Um, very 80% of it, people, 80% of people are, as I said, 75 to 80% unaware. And it also affects children. Very often, children are misdiagnosed with attention deficit disorder, ADHD, and excessive bedwetting is a finding in children with sleep apnea. So, common treatment has been to force air down your throat with this device called CPAP, but we actually do airway correction, expand the airway to make more room for your tongue to come forward and relieve the tongue tie. And this is something called the DNA appliance, which we do. I recommend a everyone get an airway study at least once in their life. So this is correction with the DNA appliance before, and you can see, look how much wider. This person on the left here on the bottom is breathing through a coffee straw. So you can see this rapid change in the airway and the position of the tongue. Here's the arch before. This is a narrow arch, almost squeezing the tongue further back in the throat after a wider, more Roman arch. So here you have a Gothic arch on the left, a Roman arch on the right. Let's talk about harmful oral care products. Um, so does everyone know why there's a poison warning on toothpaste that was mandated in 1998 by the FDA? It was because a spike in fluoride fatalities in children due to the introduction of a toothpaste that tasted like bubble gum. It was fluorescent blue and had sparkles in it. It was called Crest Sparkle. And took 10 years, but there's enough fluoride, sodium fluoride, in a regular size of toothpaste to be fatal to 2 children under 5. Now, this is the poison warning that came out in 1998. Warning, keep out of reach of children under 6 years of age. And why are they brushing with it? Well, if more than used for brushing is accidentally swallowed, get medical help or contact a poison control center right away. I don't know about all of you, but I don't think toothpaste should have a poison warning. I think toothpaste should be edible. And that's why I spent 20 years developing a toothpaste that you can eat, because it's insane to think that any child or any person would be putting toothpaste in their mouth that could have a poison warning. So I created a toothpaste that you can eat. It's all vitamins, minerals, and it's got vitamin C, D3, vitamin E, K2, coenzyme Q10, MSM, which stimulates stem cell activity in parallel. You can do a nutritional product without making it poison or using something to kill everything, whether it's natural with oils or chemicals. And so fluoride, we've been overdosed. We know that. The government knows we've been overdosed. And basically, fluoride is a toxic halide chemical that is not a nutrient. There's over 62 studies linking drinking fluoridated water and lower IQ in children. There's over 20 studies on the decrease in bone density and strength and osteoporosis and osteopenia. So you want to live long, get this chemical out of your body. You do not need it. It was the enamel of your teeth was never designed by God to need fluoride. Fluoride was looked at because it rapidly displaces a mineral called hydroxyapatite and converts it to fluorapatite, because fluoride was a made-up word, F minus, is the most highly charged, highly negatively charged, non-radioactive element in the periodic table. So it converts your teeth and bone from hydroxyapatite to fluorapatite. It's very, very, very hard. But if I drop this glass, as you know, on a floor, it'll break in a million pieces. It also makes it more brittle. It makes your teeth and bones more brittle. There is a lot of toxic effects of fluoride. And I don't want to go off any more about that. I want to move along. But again, everybody understands what we're really talking about is going from the pesticide approach in oral care to organic gardening. Not kill everything, kill germs, kill strep mutans or any of that, but promote a healthy, balanced garden. And that's why I created this. It's the first prebiotic, not probiotic, prebiotic, meaning it nourishes your indigenous healthy microbiome. Probiotics in the mouth don't work because your oral microbiome is as unique as your thumbprint. So it keeps very harmful bacteria, it keeps harmful bacteria we call pathogens, and good bacteria. It keeps you in a stable, balanced state. We just did a randomized double-blind clinical trial showing that indeed we restore low film thickness and a very low diversity, so you don't have that thick, scary jungle, but you have a healthy aerobic microbiome. And we do that with these essential antioxidants and cell energy enhancers: CoQ10, vitamin C, D3, vitamin E, K2, and MSM, which I spoke about, stimulating stem cells and periodontal ligaments, as well as a unique blend of microminerals to help your teeth remineralize naturally. First study back 10 years ago, we reduced inflammation in 1 week more than Colgate Total claimed in their 6-month studies, or 12-week study, 3-month study. They were there. But then we went further and we looked on the effects of soft tissue health, and we had a 42% reduction in gingival inflammation, 46% reduction in plaque, 72% reduction in bleeding. Everyone, folks, this is about respecting the science. I'm a scientist, and I am a doctor, and I am also a clinician, and I believe that too many products are brought onto market without science, but with all kinds of marketing claims. So the reason this works dramatically is it respects the science. This was a photo in just 4 days of changing what that person was brushing their teeth with. Let's talk about lack of exercise. Exercise alters the microbiome. I mentioned this before. There were increases in certain microbes that can help produce substances called short-chain fatty acids. These reduce inflammation. And finally, stress. We look at the effects of stress on the oral microbiome. We see that a lot of it is the signaling with the vagus nerve, gut hormone signaling, tryptophan metabolism and the production of microbial metabolites. And again, here's that short chain fatty acids